it's a privilege for me to introduce the next speaker, who I just had the opportunity to meet, Judy Graves. Judy is the City of Vancouver's advocate for the homeless, and Judy has helped thousands of homeless people and brought about meaningful change in the delivery of social welfare in this province. She designed the city's housing outreach program and has helped the homeless navigate bureaucracy and find affordable long-term accommodation for more than 30 years. I'm very pleased to note that in 2009, she received an honorary degree of Doctor of Laws from the University of British Columbia, so I would consider her as one of our alumni. Judy.
Hey, you don't want to look at me. Where's my thing? Oops. There. So, that's one of my friends. And I've got to tell you that my friends frustrate you guys and drive you crazy. But it's okay, you're even. You frustrate them and drive them crazy too. And it's not your fault. But it's not their fault either. You are in the business of healing, and you cannot heal someone who does not have a home and does not have nutrition. Those are the basics of what keep us alive. Those are the basics of what allow us to complete the healing that you initiate so beautifully. When I bring someone to you from the streets, and more often than not, we're coming into the emergency ward, the person I'm bringing in is in chronic pain, often quite severe physical pain. They are, anybody under 55, their nerves in their teeth haven't died yet, so they're in chronic dental pain. They usually have arthritis if they're over 40. They are sleeping on cement. They are in a life situation such that doing the right thing does not produce the right results. And so there is no reward in doing the right thing. There is no predictability to their day. They cope with this by a kind of mindfulness meditation. It is a way of living in the immediate now only, because tomorrow they know will not deliver what they need, which is why they're so very hard for you and I to deal with. So I dream, big time. I dream of a healthcare system that becomes absolutely intolerant of street homelessness or even sheltered homelessness. You cannot do what you do so brilliantly if the person returns to the street or a shelter. I dream of a healthcare system that becomes fervent, passionate, successful advocates for universal housing. I dream of a day when a physician can write a prescription for housing and have that prescription honored by BC Housing. And I can tell you from experience as well that if I miss breakfast, you don't have enough psychiatric drugs to turn me into a nice person that afternoon. I want a system where a physician can write a prescription that links my friend with 3 meals a day and a bedtime snack for as long as they live. With a home, with the nutrition, you'll be able to achieve success. And there is another place where my friends drive you crazy, and you drive my friends crazy. And that is in the area of addiction. And so I dream, and I dream passionately, of a time when the healthcare system can admit that we have no cure for addiction. That takes a great deal of humility, but we don't have a cure for addiction. Even the best abstinent recovery is one day at a time with no certainty tomorrow. We don't have a cure. There is no use in laying a trip on my friend. If they had the capacity to quit using, they would have quit. There'd be no cause for a dialogue, and you don't have anything to give them. And so I dream of a time when you will not have to deal in the hospitals and in the clinic with my friend desperately in need of something to alleviate their addiction. I dream that the healthcare system will right now support with all of their power the Salome Project, and will speed a way of delivering in a comfortable, shameless, sociable way the drugs that my friends need on a daily basis on the side of the healthcare system, where this will not be bedeviling the hospitals, will not be bedeviling primary care physicians, and where you can treat addiction as simply one more complicating medical factor. So, what we want: housing, food, ready access to clean water, harm reduction in a loving and kind way.